We'll go ahead and get started. Welcome, everyone. My name is Tanya Torres. I am the manager here at Oreck Bank USA for the client services team. And we are joined today by a special guest, Dr. Sarah Oreck. She is a reproductive psychiatrist and is founder of Novita Health. Thank you. So again, welcome. I wanted to, before we get started, encourage people to submit questions that they have throughout the presentation in the Q&A box. We're excited to answer them, and Dr. Oreck will be answering questions as we go. So if you have some burning questions, please submit it in the Q&A box. I'll share those questions with Dr. Oreck and she'll answer them live, but hopefully we'll have a few more at the end that we can still answer, and you'll have an opportunity to also ask me questions from the Oreck Bank USA side as well. All right, so for our agenda today, we're going to have a quick little intro as to who Oreck Bank USA is. We're going to welcome Dr. Oreck and her presentation, and later on we'll discuss a little bit about our financial plans that we offer, our live birth guarantee. And as I mentioned, please don't hesitate to submit your questions through the Q&A box, and we'll answer those throughout Dr. Oreck's presentation as well as at the end. So. All right, Oreck Bank USA. So I am the client services manager here. I've been with Oreck Bank USA for 7 years. Oreck Bank USA has been around since 2012. We've performed more than 13,000 egg warmings. We've helped so many families, close to 10,000. We are the #1 egg bank in the US, and we have one of the largest catalogs in the industry that we are making every effort to continue to grow so that all of the patients, clients, IPs, intended parents out there have a variety of donors to consider to read through their profiles. They're all qualified, meaning that they've had extensive genetic testing, psychological testing, they've gone through infectious disease screening. And so we're doing our best so that you don't have to do a lot of work when you're browsing on our database. You can choose who you like and then connect with your doctor to take next steps. We also have a live birth guarantee plan, which of course offers some peace of mind throughout this process. And we have a dedicated team, my team, they're ready to help you every step of the way, whether you have just questions to wrap your mind around financing or just getting access to our database. We're available from 9 a.m. to 9 p.m. Eastern. Okay, so without further ado, I'm going to turn things over to Dr. Sarah Oreck. Thank you so much for being here with us.
Sure. So I am really going to talk about protecting your mental health from preconception through the postpartum, but focusing on this time of trying to conceive and trying to form family, which it sounds like many of you are here with the egg donor conversation. And of course, there's different complexities to an egg donor. It is most likely something that maybe you didn't imagine doing or are kind of wrapping your head around. And so I love that the team at Cooper Surgical is there sort of to guide you every step of the way. But I think it's also important to note that some of this can bring some mental health issues and mental health struggles, and I think it's important to start to shed light on the fact that those that are dealing with a difficult fertility journey or one that has some bumps along the way are at risk for depression and anxiety. About 50% of those that have difficulty trying to conceive, where it starts to extend past a year, often have higher risks, and about 50% will deal with depression or anxiety. And this is, I think, really important to start talking about a bit more, because we know that mental health can also impact fertility outcomes and all of that. So let's go to the next slide and I can introduce a little bit about myself. So I am a psychiatrist by training, and I actually have a specialized training in something called reproductive psychiatry. Many people don't know what this specialty is, but it really is a specialty focused on how female reproductive hormones impact mental health. But also because it really focuses on the path to parenthood, have had a lot of sort of focus in my career are on those that are trying to conceive, pregnant, experience loss, and in the postpartum. And I used to be primarily in private practice in New York and California, but I found that my care was very limited given that it was out of network. I could only see the amount of patients that I could see as an individual, and really was getting so many messages from people from different states who wanted to use insurance, that really wanted more access to this care. And so with that, I founded Mavita Health, which is a virtual mental health platform really for this journey to parenthood. We do call it maternal mental health, but I want to just say that from the moment that someone chooses to start a family, they are on the path to parenthood. We think of those people as mamas already, or whatever they want to be called, or parents, intended parents. You're already facing some of the trials and tribulations that come with this journey and this immense change that happens as you become a parent. And so Mavita Health delivers the most up-to-date evidence-based therapy treatments for this population, as well as medication treatments for this really specialized time in the trying to conceive, pregnant, and postpartum, including lactation. We have specialized prescribers that can give you advice from even trying to conceive and what you should be taking or what comes with a high risk. And so it's a really wraparound platform where you can get individual therapy, couples therapy, family therapy, group therapy, as well as that really highly individualized prescribing. So as I started to talk about, maternal mental health, it impacts those trying to conceive significantly. So I said 1 in 2 individuals struggles with a mood or anxiety disorder. We actually think these are underdiagnosed because at most IVF clinics and most assisted reproductive technology sort of spaces, you're not necessarily being screened. Or if it's 2 dads that are using a surrogate, those dads are rarely asked how they're doing and how their mental health is during this experience. And we actually know that it's the #1 complication of childbirth. And yes, certainly a lot of the studies of that apply to people who are gestational carriers and are going to carry the child. But we actually know that those that don't care, so non-birthing parents, those that use surrogates or decide to do adoption, can also have those brain changes that happen during the journey to parenthood, and can suffer from postpartum depression or even depression and anxiety during the pregnancy or that gestational period. We know that there's a shortage of providers, and of course there's inconsistent screening practices. So in about 10 states in the US, they're required, so physicians, OBGYNs, midwives, and pediatricians are required to ask that pregnant or postpartum parent about their depression and anxiety. But again, we're not talking about non-birthing parents. We know that in heterosexual relationships, fathers have about a 1 in 10 chance of having postpartum depression, but no one is screening them. No one is screening parents that have used a surrogate or a gestational carrier, and no one's screening parents that have adopted children. So this is something where you maybe haven't even heard of these issues yet around this journey to trying to conceive. But I think it's really important, again, to start to shine a light on this. We can go to the next slide. And so I've been saying perinatal mood a lot. And so I just want to make sure that I explain what that means. So we really think about this, and there's that pregnancy test at the beginning, but I really think about this as like the first time that you and your partner, or if you're doing this alone, think about, I want to become a parent, and you start on that journey, whatever that may look like. And so that's the beginning. And then the end of that journey, we think, is up to 5 years. People used to think that it was only 1 year after having your child that was the postpartum. But now we know that that extends a long time after that. And so these effects, so perinatal mood and anxiety disorders, are those mental health conditions that can come up during this time, specifically due to some of the changes that happen either hormonally or because your life changes so radically, right? You need to make space for this one or two or how many children you end up having. And that changes the dynamic in your romantic relationship. It changes your dynamic with your work identity, potentially, changes the dynamic with your finances, certainly, and with the rest of your family, friends. You start to value different things, prioritize different things in your life. So this is really perinatal mood and anxiety disorders, as we talk about sort of those mental health conditions. But what I would say is this is matrescence, this whole period, which is like adolescence. As we become mothers, all of the changes that occurred. And of course, there should be a putrescence as well, because when you become a father or a parent of any sort, there are going to be a lot of changes that occur. The next slide, please. And so what a PMAD may look like is Sam, who's been trying to conceive for 9 months, has had a lot of difficulties. Notice that they're drinking more wine to alleviate the anxiety and disappointment they experience each time they don't get a positive pregnancy test. So this is expanding, again, what we think about perinatal mood and anxiety disorders. Sometimes people just associate with that like, oh, that's just postpartum depression. But again, I'm here to tell you that some of these issues start early on. And I think it's really important, especially when you're thinking of egg donors, when you're thinking of making these really huge decisions in your life, that you are well equipped, well supported in all sorts of ways, but also particularly around mental health struggles, because sometimes we use maladaptive coping strategies. Drinking is a great example, increase significantly in women, especially of reproductive age with COVID-19. We just saw such an uptick. I think it was over 100% increase in alcohol use in that population, that kind of started to border on more than people were accustomed to drinking, or more than they felt comfortable drinking. So just starting to get in touch and have some insights into, oh, what am I doing? It could look like online shopping. It could look like all these different things. Am I having some difficult feelings that I'm avoiding here in some way or another? Next slide, please. And so the consequences of untreated perinatal mood and anxiety disorders can be really significant. And here we just say for the mother, but what we really mean here is for the parent. If we want to kind of extend it, it can be for the non-birthing parent as well. Of course, for that gestational carrier, we're going to be concerned about these because those are going to directly impact the fetus and then the child. But for that intended parent or that gestational carrier, we're going to see probably less likely to attend medical appointments if there's an untreated anxiety or depressive disorder, or maybe decreased interest in getting that really high quality nutrition, lose interpersonal relationships as well as financial resources, maybe not being able to do or perform work in the way that they were at some point, and more likely to use substances. And then at the most risk is when we have severe depression or postpartum psychosis, for example, where we are concerned about safety and risk of suicide or potentially infanticide. And for the child, and again, this is mostly for the gestational carrier, so the person that is carrying the baby, and the effects on the child. But actually, when parents have depression or anxiety that's untreated, we do have some concerns about lower preterm birth, lower weight, small for gestational size, less likely to breastfeed in the postpartum, and likely to develop some other physical health issues, which are concerning, like obesity, SIDS, as well as, this is pretty interesting and something noteworthy, is that those that have untreated symptoms during pregnancy, even if there's a genetic link, so independent of that, so independent of parent having ADHD and then giving it to their children because there's some genetic component to it, that there are those children where there's an untreated mental health condition in the gestational carrier during pregnancy tend to have behavioral issues in childhood and sort of in developmental issues, which again points to, and I think for a long time, we sort of thought, well, it's better not to take any medications, no need to get treatment, everything will be fine, pregnancies are resilient, but we actually know that there's a risk if we don't treat those conditions during the pregnancy. And I would actually argue that there's a risk to not treating these conditions, even trying to conceive. There's so many stressors, there's so many changes. We know that fertility outcomes, assisted reproductive technology, we don't have all of the data, but we know that when our mental health is in a good position and a good place, those outcomes end up being better. Again, we don't know what the directionality of that is, whether it's the anxiety and depression that make the fertility outcomes worse, or we simply know that there is a connection there. And when your mental health is better, you're most likely to have a good quality of life. We all know that doing assisted reproductive technology, whether you're having an egg donor, still requires a lot of issues in terms of going to the clinic constantly. There's a lot of financial resources that are used there. So again, this extends even before a child is conceived. And left untreated, we just know that there's a higher risk of all of these symptoms in the postpartum, which again is the time where we really want a parent and child to be able to bond, to connect with one another, and for you to enjoy that time with that baby that maybe was really hard to conceive or hard to get and took a lot of time, resources, and energy. The last thing we want is for that postpartum to be really, really challenging and to kind of miss some of those really amazing, I think, infant days. And of course, that early attachment, we think, has a lot to do with how we develop in terms of interpersonal skills. And of course, if you do have postpartum, there are ways out of it. Your baby will be okay. But I think it's important, if we can, to set yourself up for success from the very beginning. You can go to the next slide. And so how do you take care of your mental health during donor egg journey? So this is, I think the first important thing is to connect with friends, family, and share a little bit of what's coming up. A lot of people don't wake up or as a young child and say, I can't wait to get an egg donor. This is my dream, or this is what I always thought about. But it sort of, depending on how you're forming your family, what type of family you have, this may be pretty unexpected. This may be something that you didn't even know existed. So that can be a really challenging idea to get your head around. This is not my genetic material, but I can carry the baby. And even if you're not carrying the baby and you have a gestational carrier, what that connection is, whether you have a connection, right? There can be so much confusion about what this is like. And I think connecting with those that you trust and you feel like can be a good support system is a really good start. I also love the idea of connecting with peers. So, people that have gone through it, people that have a child on the other side of it and can tell you, maybe it's not my genetic material, but this is just my child, right? Look at this gesture that they're making. And that's really interesting. This is a whole other topic, but we have a lot of information now on epigenetics and what happens after an egg donor is used and it's implanted and you're the carrier, or even if you're not, what happens when a baby is in your home and that your genetics and the sort of environment actually influences the genetic makeup. And it's really kind of fascinating, because all of the patients I've worked with that have ended up using an egg donor, it has not been necessarily what they thought was going to happen. It's been years after struggling. And yet at the end of the day, right, this conversation of, is it mine? Is it my genetic? Like, it just disappears, because in some ways, we know that the environment is so strong and your genetics afterwards are even influenced by what's occurred, that you become sort of a part of, this child and parent bond is just inextricable and hard to explain. But it's really I think it's nice to have peers that are going through it with you, but also at the other side of it to kind of tell you what that whole experience and journey is like. And that can be really helpful because of the confusion, the disappointment, the sense of sometimes failure that comes with this. But ultimately, it can really come to some great experience. And the idea that forming family can be a really diverse and it's a non-linear experience for many. And so the inner experiences and feeling stuck or feeling like the ways that we often talk about ourselves, think of ourselves, feel that our bodies have failed us. I think those are really important to, if you can, talk about it with friends and family. But if you can't, there are therapists that, like at Mavita Health, there are, and certainly there are outside of Mavita Health that are specialized in this area and have a lot of background in sort of how to deal with some of this feeling of being stuck or shame, not wanting to reveal that you're on this journey. There's a lot of complicated things here. But I think at the core, and I'll talk a little bit more about this, of what we first do at Mavita Health in our therapy model is we talk about values and what your values are and how they change over time. Maybe when you were young, it might have been academics. I certainly know it was for me. It's the only way you get in through medical school. Or work is something that's a really big part of someone's identity. And then things shift, right? As that seed is planted of wanting to become a parent, you maybe started to find the shift in like, oh, this might be really much more important to me than maybe getting that raise or getting that promotion was. And so starting to reflect on what are your values now. And I think this is a way that I've helped a lot of my clients who have been, had feelings of shame that their body failed them, that they had, after struggling years of trying to have IVF or, maybe waiting a little bit longer to have a child and then having difficulty conceiving. But once you have that value set, and for many people around this time, the value of having family kind of jumps to the top. And if having family is what's most important, then we start to discuss, well, what about that baby having to have your egg material, your genetic material? How important is that? And most people find that actually that forming family is the most important thing. And so how does that shift, my flexibility around how I can form family? And so this is kind of part of the process, a little insight into what happens. It doesn't happen overnight. It often takes a long time. But this is kind of an interesting way to start thinking about this, or how your values may shift over time of what you expected was most important to you ends up taking a back seat, and kind of starting to feel comfortable with that, including, right, that job, friends, the things that kind of lose priority versus when you're in this family planning and family forming time in your life. I just talked and started touching on this, but flexible decision making, I think, becomes really key early on, or when we're taught to kind of have some rigid ideas of what family is like. We're very stuck on it. It has to look this one way, or it has to be this particular way, or else I don't want it. But I think, again, when we tap back into the values, what I hear a lot is like, well, it sounds like I may be at the end of my journey of being able to use my genetic material to have this baby, or maybe it wasn't possible to start with. And so I'm going to have some flexibility and say, I think that there's these other ways of forming family that sound like they're a good idea and would meet my goal. And again, I'm making it sound like it happens like that, and this happens over time, but that flexibility is really important also in what it looks like, whether you have a surrogate and you have to, in some ways you can write as many things of what they shouldn't do in the contract, and you can agree to things, but ultimately that's a person that does not necessarily live with you, is making their own decisions. And we have to sort of, I think, give up some control or have some flexibility of what that journey may look like. And I think this is all really interesting and exciting because it primes you to having children. Children is the ultimate loss of control, though they're a part of you that sort of exists somewhere else. But in some ways, you have to be flexible and kind of saying, oh, they might fail, they might fall, and yet we have to kind of come to peace and come to terms with that. And I think that is the when there is that flexibility, that is the most I think ease that people have in having a parent-child relationship. I also have to say, for those families that have used egg donors, the process is a bit longer, and so there's a lot of preparation. I tend to see in my practice that the parents tend to be older, and what I see, which is really exciting, is actually a lot more ease in parenting. So it's just, there's been so much work, especially those that do have that support, that get the mental health care, that this parenting journey and these changes end up being a little bit easier than they do for like the general population, or those that maybe had an unintended spontaneous pregnancy and just sort of it happens to them. And including in that toddlerhood where kids start getting a little oppositional, a little challenging, they really push your boundaries. I do see that, again, because there's been flexibility here, there's been so much going into it. I'm not saying that there won't be hard days, but I see a little bit more resilience in the parents that have chosen to go this route or have had to for a variety of different reasons. And the other sort of big part of our practice, and it should definitely be part of anyone's mental health journey, is to identify and practice coping skills. What we want at Mavita Health is for everyone to become their own therapist, so that you're not dependent on that one therapist for support. And let's say you take a week off and then you're kind of spinning your wheels, for you to actually be able to take the things that we learn and help yourself when you're having a really hard decision, or when you're making some difficult kind of life-changing decisions. We really want you to be equipped with exercises to help yourself. Go to the next slide. And so here's a little bit more about Mavita Health. Certainly, we think the first layer of support should be your friends, your family, your partner. We love peer groups. We actually have some of that in our community. So we know that having shared experience and just hearing, oh, Susie's also going through this, or, oh my God, Bobby had this experience and now he has a 10-year-old, and how exciting and how connected are they? And kind of hearing what that experience is like is really, really powerful. So we do that through community sort of support groups, as well as one-to-one peer guidance. And then we have these other pillars, including content, which is all evidence-based to your particular journey. We're actually developing more for the fertility journey, including all these different ways, whether it's a donor egg, or it's a donor sperm, surrogacy, what that all looks like, because those are complex and we don't hear enough of those stories, unfortunately. We're hearing a lot more of different and diverse stories, but I think more of this is important. And then we have clinical care. Currently, it's only available in California, New York, and New Jersey, but we are quickly expanding, and that's all of the therapy offerings as well as the prescribing for mental health conditions. We can go to the next slide. And so this is a little bit of our particular approach to care. I think it'd be great if we could have questions in particular, but I can go through a little bit of what we do and kind of talk about it. It's a little bit, I'll try to break it down as much as possible, but our approach is really based on a cognitive behavioral therapy called acceptance and commitment therapy. And it's a really fantastic therapy that combines some of the things we love about cognitive behavioral therapy. So we love that it's a manualized therapy. That means that it's very consistent between all of our therapists. So no matter which therapist you get, you're getting a very consistent quality of care. But also this type of therapy combines elements of mindfulness, so how to be present, as well as elements of doing some of the homework on your own. So again, almost like a physical therapy model, you're doing some things with us in individual therapy, and then you're practicing them outside of session. But what's exciting is that you can do these even if you're not in therapy, and kind of work on them yourselves. And so part of what we start to do is opening up, is sort of starting this journey of acceptance. And it's not in any particular order, but also, and this is really to start to get comfortable with those really uncomfortable, unpleasant, unwanted thoughts that so often our culture and tends to say, well, let's get rid of those, right? That's what we talk about, like toxic positivity. Like we just want the good and the positive and tell me how you're doing. And I just want to hear, oh, I'm good. I don't want to hear like, actually, I'm struggling or I'm having to make this really big decision. So starting to get comfortable with these uncomfortable inner experiences and often having fertility struggles, making a decision, let's say for a donor egg that you never intended, can be exactly that. And so this again takes a little bit longer. It's a little bit here. It seems like it's so easy, but we do try as much as we can to start to experience and acknowledge what those difficult feelings are. So we start by naming them. And then we start by really trying to think about the ways that we go on autopilot, the alcohol, the shopping, the sex, like all these things that we do to kind of numb these difficult experiences. And think about, we don't have to like go around all these things. We have to go through it. And how we do that is um, kind of opening our eyes to some of this, exploring what that feels like to have uncomfortable and unpleasant, unwanted thoughts and feelings. We can't get rid of them, right? So it's almost, how can we start to experience them and live with them, while also, I think soothing ourselves, but in coping mechanisms that don't feel like autopilot, like we're just doing it because we want to numb ourselves or something like that, and sort of really explore what these quick fixes are that often we think about. We can go to the next slide.
It does look like you have a question, Dr. Oreck. Someone asked, do you see different considerations and journeys to acceptance for individuals using double donors, such as donor sperm and donor egg,
Yeah,
compared to individuals using just egg donor?
I think that's a really, really great question. And it can be so from my experience, it can be so individual. There's something about the double donor that feels like, oh, especially if you have a partner, we're in the same boat. We're having parallel experiences that can sometimes feel like a little bit more support. I find with the single donor, there is often like the partners, especially, right? So if one, it's their genetic material and they're using one donor, there can almost be like a challenge because they're having slightly different experiences, right? One will have their genetic material, and one won't. And so often there feels to be a little bit of a conflict, or my partner doesn't understand what my experience is because I don't get to give this genetic material. So I think across the board, it is kind of different for everyone. And listen, some partner in a double donor will be like, it's not a big deal to me. And the other one will be like, well, this is something I never expected. This is a lot for me to process. But I tend to find that the most challenge isn't single or double donor. It's more like, are partners on the same page? Are they experiencing something similar? Which again can be a real struggle when there is sort of like discordant kind of experiences, when they're not totally gelling. But this is where it's important to kind of acknowledge and talk to each other about like, hey, listen, I think you're having a really different experience than I am. That may mean that the person that's struggling a bit more needs more mental health support or more support outside of the relationship, for example. Great question. Okay, so our approach to care, and I started to kind of talk about this, is really around flexibility. And this is where we say you can't choose your feelings, you can't choose your thoughts. As much as we like to say, oh, I can try to make myself feel better, or I can like not think of this thing. What happens when I tell you don't think of a pink elephant, right? It's the first thing that's in your mind. And so we often think about that rejecting those difficult thoughts is like bouncing a tennis ball off of a wall. Like it's going to come right back in your face, maybe even stronger. And so what we do know is that we can choose the way that we behave, right? And not react necessarily based on these negative thoughts, feelings, or emotions when we don't kind of understand what's going on or having insight. A great example is this. I could say, all I want in life is to start my family, but I'm going to have to use an egg donor. But I have such negative thoughts or feelings about myself, about what this means. I don't even want to face it. So I guess I am just going through all of the names, critical of every single egg donor, kind of saying, oh, they're just not going to be good enough. I don't think this is the right fit. Right. And so that's a behavior where I'm getting in my own way of what my actual value is, which is to start a family and potentially be able to, let's say, have that pregnancy or carry that child because I'm able to, or whatever it is. And so our thoughts are around this is we've got to get a little bit more flexible. And the way that we do that is we kind of think about, okay, I want this particular value, and have my action be driven by that value instead of getting in the way of the value. And so what we see and what we've been seeing in our patient population is higher levels of well-being, lower stress, greater self-reporting in terms of functioning, of being able to go through the day, and of making those value-aligned actions and behaviors, where it's like, yes, I had a lot of ambivalence about an egg donor. I don't know those people, right? I only can read about them. But ultimately, I decided there was characteristics that I thought were helpful to me or that I valued in that egg donor, and that will help me form my family. And again, what's really exciting about this is once you get that type of care, even again, before you're even having this child, when you're able to have that psychological flexibility and potentially teach that to your children, we see that there's lower internalizing and externalizing behaviors in children. That's like lower depression, anxiety, as well as those behavioral issues that happen in kids, and better emotional regulation, both for parents and children. And so I see another question.
There's a question that says, how to explain and do counseling with your child that is donor conceived? In their mind, they say, it feels like they're half adopted, but I would like to know how counseling works when the child is born.
Yeah, there's a lot of theories on this, but I think where I feel like I land is kind of being open from the start. There's some wonderful children's books now created that particularly target these types of ways different families are formed. So introducing the idea, I think, is really important early on in an age appropriate way, right? Like a 5-year-old, you're not going to tell the whole story to of how exactly it works, but you might say something like, um, you know, uh, your friend, whatever, like may have been conceived in this way, or Susie may have been adopted. This is how we conceived you. And you kind of talk about, if you're ready to talk about, what the biological sort of gametes are of a man and a woman, and then how your family came about, and whether, someone was generous enough to donate theirs and that worked for them. But that still doesn't mean but mommies and daddies are something that is because you've taken care of you, because we've had you since you were a baby, because we teach you this, you live in our home, you're with us, right? That's very different from what the biological material is. And again, if you want to talk about the word adopted, that's okay. I think it's kind of feeling out what's best for you and what sounds right for your family. But I like the idea of sort of keeping it open. I think as the assisted reproductive technology over the last 2 to 3 decades have become so much more prevalent, this is not going to be a totally unique story, where you will have some shared community, shared experience. And certainly this is where I think it's really nice to have peers to kind of ask, how are you talking to your son about this? Or how are you talking to your daughter about this? But I think openness, curiosity, what they may think of this, what may happen. But ultimately, when there's a strong connection, support to your children, when you provide a loving and nourishing home, right, these conversations become easier, because that's not going to be challenged. What's happening, that you are the mother or that you are the father. And so I think that there is certainly a unique way to bring this about. I think really following your child's lead. Some children aren't that interested in it yet. And so kind of following the lead of like when they become curious about it. To be honest, I have some patients with some older children who are like, okay, like I don't really care to delve that much into it. Like, where it's not, I think it doesn't feel like much of anything or that abnormal. And I think that's been because the seed has been planted, But again, that strong connection is like, okay, well, this is what I see. And, my next door neighbor who maybe spontaneously conceived and had a very traditional linear picture of this looks a lot like my family. So, it's no big deal. So I think certainly it is complex. It is worth being thoughtful about, but I think it's also following your child's lead. And I do think explaining things without too many euphemisms and kind of just saying how things happen is really nice. When kids start to understand how reproduction actually happens and how sperm and an egg meet, like I think that could be an interesting time to start to explain that there's all these other ways of forming family.
We do have another question. Someone asked, do you see trends regarding working with a known donor versus an unknown donor?
Oh, that's interesting. I haven't seen particular trends. I'd be interested, Tanya, to hear if you've kind of seen that. What I have, I think the known donors are, wonderful. There's something really like altruistic about being able to share that with your family or your friends, but I think it's really complex. There's something sometimes about an anonymity of an unknown donor that I think makes people feel in some ways, or what I've noticed with my patient population, in some ways like less threatened. There's something about like, oh, auntie is actually the egg donor, and this threat of like, well, will there be any confusion here? Will there be more connection because that person may be in the child's life as well? And for some reason, that unknown donor for some can just feel like, this is someone we will never meet, who potentially will never be part of our lives. And that feels less threatening. So I think if you're lucky enough to have a known donor, there's can be some really great aspects to that. But I think it can also be some complications. And so I think it's okay if you feel like, you know what, the anonymous kind of like, I have a little distance from that is something I'm more comfortable with. And I've certainly seen that. I guess I just haven't had that many experience with known donors because it's a little bit more rare, frankly, that
Mhm.
it's happening.
I mean, all of the donors that are on our database are, it's not a known donor situation, but we have donors who are open to future contact
Right.
with your child, right, at legal age of 18. And so I think it kind of loops back to what you mentioned earlier about community and really just discovering what's important to you and your family. More and more we're moving into a world where anonymity is just not really promised. There's so many things
Oh,
out there.
yes. And I think, right, that your children will find out who their donor egg is. But I mean, and I think this question maybe, but maybe they can clarify, is the difference between like having a donor who is actively part of your life every day,
Yeah.
right, who's your sister, your cousin who you see with
Yeah,
frequency or at family functions, brings a layer of
that's
complexity.
true. Yes, that's true. I wasn't thinking about it in that way. Yes. That's
Right,
what's
right,
great
right.
about
Like
two
if
different mind frames.
right. I thought friend and family member, I imagine, is someone you see with more frequency. And so
Mm-hmm.
what that like layer of kind of having to explain potentially who this person is a
Yeah.
little bit earlier on, then again with the and I would just say, right, these aren't anonymous. When your child is of age to find them, with all of these genetic testing, they will
Mm-hmm.
likely find this person. But what it's like to have a little distance from them on a daily basis,
Yeah.
especially when the child is young, is sort of like an interesting thing. Here's as a donor egg recipient, do mothers have difficulty connecting with their new babies? I would say absolutely not. I would say that is something that I have to say I imagined might be difficult, and sort of I always ask about, but I find that they're some of the most connected to the new babies. It's really an exciting kind of experience that I've had, and I made those assumptions before, and like I asked so much about how's the attachment, how's the bonding going, and it's really been so remarkable, and especially even in the patients that had so much ambivalence about the donor egg experience. I just see such a difference at the other side of it. Of course, these are my patients, so they have been taking care of their mental health throughout the experience. And that's been really exciting. But I haven't seen difficulty at all connecting with their new babies. And it's so interesting. Like one of my most recent patients who had a lot of challenges was very hesitant to do the donor egg experience. She was the gestational carrier, so she ended up carrying her baby and then had him. And I asked her at one point, do any of that like same ambivalence, those thoughts of like, it's my husband's genetic material, but not mine. Have any of those popped up? Is it something you're concerned about? She's like, I haven't thought about it once. Like it's just so far in the distance that it's just not something that comes up for me. But I will tell you, when she was going through this, when she was choosing her egg donor, it was something that was coming up for her 5-10 times a day. And it's really kind of changed so much.
Yeah, I mean, and I would just mention, just from my experience with um parents who I've talked to, it's just it's like entering a new stage of life, and all it's, they, what I've heard sometimes is where everything that happened up until then was almost like dreamlike, where we're entering a new stage, and it just feels whole for a lot of
Yes,
people.
that's right. I love these next couple of questions. So, any coping recommendations for high risk pregnancy individuals that must do donor eggs and are experiencing extreme fears of miscarriage before even starting the donor egg process? Um, I see this a lot. I think this type of experience is one that's pretty common in the sense that you probably got to a donor egg because there has been a history of loss or of extreme difficulty with pregnancies. And so, what I would say here is if those extreme fears are happening, that can really, I think, inhibit the joy you even feel during pregnancy, right? A positive pregnancy test becomes, oh, yeah, this is nice, like a little bit of joy, but like, oh my God, I have to, like, we're only at 4 weeks. Like, what's going to happen in 8? What? Oh, well, now I have to wait till the anatomy scan. And I would say it'd be fantastic for you to get some support around those fears so you can actually enjoy a pregnancy and be open to the fact that the pregnancy may progress and may end in a live birth and your own baby. And so I always think if you're having extreme fears around loss, around delivery, around all of those things, it's really a good idea to get some professional help so you can kind of get through those fears, through that trauma that you may have experienced in the past, so you can really be open and have a better experience this time. So have you seen differences in mental health experience for individuals that seek donor eggs outside of the United States for more cost-effective options? I actually haven't had this experience with any of my patients seeking it outside of the US. I've had more experience with patients using donor embryos because of cost issues. And that's been within the US. But listen, I think around the world, there's a lot of different rules, a lot of different laws. And I've actually seen more people want to come to the US for their assisted reproductive technologies because of more restrictive laws and sort of less technological advancements. I have seen some people sort of do this in Mexico. But again, that also requires a great deal of resources. If you don't live there, you have to travel back and forth. Like, I think it ends up being a wash, but I'm not an expert on that. Maybe Tanya can speak more to that.
Yeah, I was just gonna say, I feel that it kind of brings a different like a different type of stress added of just the coordination
Yes.
of things.
Yes.
Like you said, if you have the resources and perhaps someone with that journey, and there's somebody already who's laid it out for you, perhaps.
Yeah.
But I do think a lot of people kind of, there's some added questions and
Oh,
concern
yeah.
that's not the
I mean,
same.
just imagine having to travel, what the work is like. I mean, that seems really, really, and internationally, right? That's really
Hmm.
complex. So I
Hmm.
think sometimes I agree with you. It kind of adds a layer of stress, which travel does nowadays. TSA doesn't make it easy. So I think that could add a lot of layers of complication. But of course, doing whatever is right for you. And like Tanya said, if there's someone in your life who has laid it out, if or you have friends in a particular country where it could be kind of easier to coordinate, maybe that is a good idea. Certainly, I think this is an important thing to talk about, but it's hard, but I feel like finances do kind of impair or impede some people from having and making the family choices that they want, but it shouldn't. And that's what's really, really challenging here. That finances can be such a sort of cost prohibitive in a lot of these ways. So there are some really good grant programs across the US that can help you in forming family. But again, I know those are limited and challenging to get. What do you find the most common characteristic that individuals are looking for when selecting their egg donor? Oh, this is interesting. I think Tanya maybe knows more about this. What I see in my patient population, and I think it's again because we've been taught, because we've been programmed to, in some ways, have our children be like a reflection of us or more of who we are. And so I tend to see people who want themselves reflected in the characteristics of the egg donors, everything from physical characteristics to intellectual characteristics. But I think some people are like, I want a little leg up. So maybe the educational piece might be something that's important. Again, I think it's where your values are. If you were really athletic, then maybe that person having a history of being a fantastic athlete is something that's really important to you. But what I tend to see is like people, again, wanting to reflect a little bit about who they are in the egg donor, but also maybe some characteristics that they didn't have.
I agree very much with that. I want to say that the majority of people probably are looking for someone who has some similar characteristics. Now, specific skills sometimes come into play, or people sometimes, I would say sometimes are looking at the answers that a donor provides to their open-ended questions,
Yeah.
to see that they can find a connection,
Yes.
in their words. And so those are kind of, I know that like one of the people on my team, like that's her favorite section,
I
just
love that.
reading their answers. Um,
I
and
love
I
that. And seeing like, oh, could I connect with this person? I think that's such a nice way of doing it. I also have to say, I'm thinking of one of my patients in particular who used an egg donor who had a pretty significant history of substance use disorders. And here's where there's like this double edge, which is kind of interesting, where she felt like I have so much ambivalence about this, but I'm so excited to have a egg donor who didn't struggle with these issues because maybe my child won't have to deal with what my brother dealt with, what my father dealt with, what I dealt with of having a long history and difficulty with alcohol use issues, for example.
Yeah, yeah, and I will say that that's something I think I see as well. And it kind of comes down to like your own health history sometimes, and just wanting to, again, it's all about giving life, that miracle of life, and giving that that best opportunity. It sometimes becomes like a really beautiful journey of an experience of finding a match. It's almost like, I don't know, it's like love.
Yeah. Yeah, that's right. It's like when you found your partner or whatever,
Yeah.
there's something there that's really important. And
Mhm.
I've seen, people have parties to choose and have their family and community be part of that, which I think is really nice because this often and in the past, and I think it's changing, was such a like secret, right? Like I don't want anyone to know that this isn't my biological child. And now there's more openness to like, let's talk about it. Let's choose someone together. Let's have this be like a shared community experience, which again can go so far.
I agree. And I think also it's important, like you said, and I just repeat it because I do get calls and I talk to a lot of people who don't have a community, but seeking one out, I think surprises anyone. It surprises me even, just to find the groups that form on their own sometimes, like online and through apps and programs like yours. Like it's incredible, and I just, I feel like they're just a wonderful resource to
I
have.
know. And I think people are just waiting, to have that comfort of like, okay, can we talk about this? Have we had this shared experience? And so the more that we kind of feel comfortable with being the one that's like, hey, that's me over here. I think a lot of people have experienced this with pregnancy loss. Like before they have a loss, no one has talked about it. They have no idea anyone that's had a loss. And then the minute they say, oh, this happened to me, like all of these people come up and they're like, oh, me too, me too. I did too. I'd had this experience. This happened to me. Da, da, da. And you're like, what the heck? Where were you this whole time? Right. And so I think that's what we kind of tend to see once we feel, we take that leap, we're vulnerable enough to share what our experience is, that we see and find a lot of people with shared experience. Wonderful. Oh, I think a little bit more here. Again, this is more about how our modality and how we kind of figure things out, but tuning in or mindfulness is a big part of our approach, which again can be so helpful as you're going through all these bodily experiences, potentially had a lot of fertility treatments or are going into a pregnancy. Getting in tune with your body is so important. The next slide. And this is again how we end up moving through our journey, but it's really to engage and actually act on those behaviors and act on those things that really align with our personal values, right? Like not holding off on like picking the donor or criticizing all the donors, because in the end, right, what you want is to form a family. And so aligning your decision making with your values means that there's actually no incorrect choices. It just guides you to a path that really resonates with what matters to you most. And I think that's what our therapy is all about, and getting you to the place that you're say like, donor A is not right, donor B is not a right or wrong decision. It's just about figuring out who's the most value aligned and what resonates with you most. But we really try to get people to get rid of this idea that they're making a right or wrong choice, because we always kind of think about those things. Next slide. Oh, and then we had an exercise, but I think we're out of time.
Yeah, we are, but thank you so much, Dr. Oreck. We really appreciate your time and for your slides. That presentation was excellent. I would love to invite, our clients to call us, all of our intended parents or parents looking to be a parent again. Our toll-free number is 855 2443. Oh, I'm so sorry. 855-344. Oh, our number 240-778-6210. And our 800 number is 855-344-2265. Again, we're here 9 a.m. to 9 p.m. Eastern Standard Time. So hopefully one of those windows works best for you. And we want to be available when it's convenient for you. And just know our team, we have people who have gone through this process. We have people who are just so caring, have a long experience working with our database, our donors, and can answer a lot of questions and perhaps even point you in the right direction to get your questions answered. Sorry.
And if you have if you have mental health issues or you want to check us out, we're at mavitahealth.com, and there you can sign up and gives you all the explanations to get on the app, which is available on Android and Apple.
Yeah, and if you have any outstanding questions or would like us to send you Dr. Oreck's information, be sure to contact us. We'll get you connected to the right source. So
thank you so
thank
much,
you so
Tanya.
much.
This is great.
Oh,
Bye-bye.
it's great seeing you. Bye-bye.